No problem.
All right, go ahead.
Thank you. I have a lot of questions here that were pre-submitted, and I'm going to try to kind of pick them because Kiss, Betsy, John, I was capturing other things around this. This is an anxious time, right? We know this isn't the last pandemic we're probably going to have to deal with as we kind of deal. People say the new normal. I don't know if there is a normal in this. But, you know, what are you thinking about priorities going forward, how we change how we do work? And particularly from Betsy, and I love the patchwork, you know, map that you showed. What do we need to be thinking as a partnership for food protection? How do we change our operations? And that's really a question for the entire panel.
Well, Barbara, this is Betsy. I hope you can hear me. I'll take that. I would say, and I'm happy to share with this group, our organization got together and really gave some thought to this. And about a month ago, we released our top 10 items of what we thought from a broad regulatory space that we think should be permanent. And I think one of the ones that would be most relevant I'll share some of them that will be most relevant for this group, because I don't see this crisis ending. I'm not saying new normal anymore. I'm saying it's normalized. I think we're becoming used to this situation. But one of them is the use of technology when we know that this crisis puts at risk ourselves and our employees. So how do we use technology? And that's why we were really pleased to provide insights to AFTO on some technology changes. But I would tell you, our members are looking at, you know, GoPros, FaceTiming. How do we do the business opportunities? And can that be applied to the regulatory space using different technologies that maintain the highest level of product safety, but also protects our employees? We've talked about how do we, for best practices, I spent a lot of time and I interacted with many of those panelists and those that I see that are on the chat when we were building out best practice guidances. Because industry was in a unique space, we were able to develop best practices, I think, at a faster rate because of just interior clearances. So can that best practice be moved forward? Could industry help develop, be more collaborative, provide these to regulatory agencies, get their insights so we make sure we get the best, timely, risk-based science guidance out there for not only your staff, but ours. So those are some high level, Barbara. I'm happy to give other examples if needed.
That's great. That's great, Betsy. Other people, other regulators?
Sure. Well, this is Steve. I guess I'm a recovering regulator, maybe is the right term. But I think for the first time that I can ever remember, it was very, very hard to get information out of government agencies in a timely fashion. Everything was behind the curveball, after we needed it. So that was, I think we're going to have to rethink how we do that in the future, and whether we just don't even ask the question, but we figure out a way to get informal feedback very quickly and not have the agencies issue guidance or any sort of formal information. So it's something that I think we're just going to have to work through because it didn't work this time. One other thing that I'm going to throw out there, and I know this is a manufactured food call, but we also saw a giant capacity issue when it came to restaurants and retail foods. The sheer number of questions in that arena, and there was no one to provide answers. It was a vacuum. And I shouldn't say no one, but it was, but the level of ability to respond to the federal level, just due to that's a very small program, was very small and just definitely not timely. I think that's another thing we have to take out of this is, when we get to a pandemic situation, we're going to be have a huge amount of hit at that level, and more complexity at that level, and we're going to have to be able to respond more quickly. I blame that partially for what we saw as the patchwork of things that happened at the state and local level was there just wasn't as timely of information, and I'll take some blame for that too. We'd never thought in the wildest world we'd be the ones issuing the guidance on some of these things, but in the end we were.
Thanks, Steve. Good points. Good points, both of you. Others?
Barbara, this is John Luker. You know, the whole aspect of virtual inspections is certainly a new thing to consider, and from a technological standpoint, it's certainly something that's doable. We've talked to some of our state counterparts who are doing similar inspections, and we're going to be, I know, working with AFDO on maybe piloting something in New York State. I'm really intrigued by that. I think that's going to help a lot. And it may not be possible in all circumstances, but you know, for the times it can be used, that's a little bit less time being spent in that realm. The other thing that I would mention is that I know we and myself personally worked very closely with academia, specifically Cornell. They're holding office hours on a regular basis. It's very interesting. Anybody from any part of industry, whether it's retail, wholesale, farms, they call in with questions. I mean, academia has a lot of the information based on the resources they have. And as a panelist on that task force, I know myself, I learn something new every day when I'm involved. And it's not every day; it's once every other week, but every time I'm on one of the sessions. So I know we work very closely with Cornell, but I think in times like this, sometimes we do have to reach out to our academia folks too that have good information as well.
Good points. Thank you. Pat, reach over to you. Do you have a question? Do we have one, Maria, submitted through the chat?
I do have one. For KISS, what type of cooling devices are you using or approving for inspectors complaining about discomfort or heat using the PPE?
I don't know specific brands, but I know that one is like kind of like a vest, like, you know, where you put ice packs in there, and you can kind of, you know, wear a vest made out of an ice pack type of thing. So that's one type of device. There's been other ones that we've kind of identified and put on our you know, our list of procurable items that the field can request. So I just can't think of them all on the top of my head, but some of them are like, you know, kind of like those gaiters that people wear over their face, but more for their neck. So it provides cooling for the neck.
Great. Any other questions, Maria?
I'm not seeing any coming in.
So for, we had one other one that we did receive here earlier. Can some of the programs talk about any of the challenges that you may have had as you had to shift kind of the modality of your staff, you know, in their work environments, whether it's, you know, shifting them to a work at home base or even really significantly modifying the way that inspections were done? Did any of you come into challenges with union contracts or other issues that required some extra work to kind of be able to work through to be able to get things so that your staff could operate in this new environment?
Hey, Pat, this is Betsy. I'm not a regulator, but I could talk about some of the challenges we've been experiencing from the industry side on this. Particularly, I'll just share personally with our own team.
Great, sure.
You know, I think, you know, connecting with people, and my job as a trade association, our job is to convene people, and we convene people and we interact with other aspects. I think what we're learning during this crisis is, and I'm encouraging our members as they interact with, you know, the regulators at every level, you know, make sure that you make that personal connection. And I can tell you, as someone who leads a team and everyone's working at home, I try very hard to appreciate the challenges of doing this job when you may have kids and other aspects. And so for me, the challenges of working from home is making sure that I keep the humanity in what we're doing. It's easy to get blocked up on video calls and conference calls all day, but making sure we're touching base with staff privately to see how they're doing. Our organization is making sure we have some of the tools and are working with leadership consultants and other aspects to make sure that we have those tools for our staff, and then also realize as they're interacting with government, with members, that they recognize the situations for what they could be and others, and being self-aware of that. So that's just sort of high level some of the aspects we're doing to maintain this virtual work environment.
Thanks, Betsy. John, Krissa, any?
Yeah, Pat, I think Betsy makes a very good point there, and our inspectors typically work from their home as a rule anyway, for the most part. But the home life is something that they and in turn we had to kind of make some changes for, because when the schools close, to Betsy's point, when the schools close, when other businesses are closed, and normally it's just there's no normal. We've talked about that, but they need to make some adjustments in their scheduling, which really, as it turns out, it seems to be a huge undertaking when you're looking at it ahead of you. But once these things are dealt with, just like the telecommuting, our office staff telecommuting, we thought, well, there's no way we could ever have all these people telecommuting. Well, as it turns out, because of the pandemic, we do, and they're being very effective. So it's, in some ways it's enlightening, and in other ways it's just being a little bit more flexible.
Good point. I agree. I think those are all challenges that you face. Have you come into any situations where the staff have expressed safety concerns with going out and actually doing their normal daily activities? I think I heard John, talk about reassigning, some of the staff that, may have been a little bit more advanced in age than others, or may have had some pre-existing health conditions, to try and keep them safe. Obviously, we can't do that with the entire workforce, or you'd have nobody ever out doing any inspectional work. But has there been any challenges that your programs have faced where staff have just said, we just, from a safety standpoint, I don't feel comfortable going out and doing this work, even with the PPE you give me, and how are you addressing those issues as they come up? Anything in that arena yet?
This is Kiss. Go ahead.
No, go ahead, Kiss. Go ahead.
Yeah, so I think early on, when we didn't have a lot of policies around, face coverings and the like, and everybody was in the field was still expected to carry on with their jobs, I think we did see a lot of concerns coming up on those town halls that I mentioned. A lot of inspectors felt, as if they, and rightly so. This is a human thing, that they were basically at risk, and and nobody was doing anything about it. And it was a rough time to try to assure them that we did care. This was before CDC came out officially and said face coverings are recommended, and a number of inspectors wanted to improvise and make their own face coverings, and there were concerns with what the optics of that if our inspectors were coming into these plants wearing, face coverings, but plant employees weren't, and we didn't have science at that point to support it, so it was a hard time trying to figure out what to do. In the end, what we said was that our inspectors could wear face coverings of their own making as long as they were professional looking and clean and everything. We weren't going to prohibit that from them from doing that, especially if the plant management was okay with it. And unfortunately, after we came out with that policy, that was when CDC officially said face coverings are recommended, and so then we could officially change our policy so that it was across the board what everybody should do. But there was a time that we had to navigate that. We had to deal with that concern, and and I don't know if we would have done things any differently because really it was a lot of uncertainty, but it's something that we will always have to consider in these types of situations. You're going to deal with uncertainty, so how do you best deal with that, you know?
Absolutely. Thanks, Kiss. John, do you have something?
Yeah, I was just going to say, you know, the safety of our inspectors, frontline inspectors, is always first and foremost, and you know, some of it is just really training them about the social distancing, not so much about what social distancing is, but that they are also responsible for their own social distancing. So, you know, if they're in an environment where that's not possible and the other person is not wearing some type of face covering, then that's a risk, and they don't need to put themselves in that risk. They can, just like if there was somebody threatening them with some other means prior to COVID-19, we don't expect them to remain on site for situations like that. They leave, and they report it to our compliance unit. You know, safety is first and foremost for us as a department, but it's also should be for each and every one of them individually, and that's important, especially some of the smaller facilities that you go into in some of the larger cities. The other is social unrest that was going on and continues to in some areas. We don't expect our inspectors to put themselves in harm's way to get an inspection done when there's concerns for a particular area, so they may have to move to a different area of their assigned territory or work with another inspector in a different assigned area. So just kind of going with the flow each time, each day when things come up.
Great. Thanks, John. Krissa or Glenn, anything from your end of things?
Here in Georgia, I mean, I'm echoing the same thing that others have said. The biggest challenge was the fear of getting back out into the field when it was time to begin those inspections. We were struggling to get the PPE just like everybody else, but when we asked the team, what would you feel comfortable with? And we made them an active part of developing our procedures as well as what protective gear they wanted to be issued. Cost was a factor, getting it was a factor, so those were some of the things we were having challenges with. I didn't really have anybody on our team having any major concerns. If they did have some health issues or some concerns, then we sent them to our HR department and let them talk through. We have the same policies and federal procedures in place that, you know, each state has been afforded, whether they can use leave or whatever they need to work out to be off. School is starting back here in Georgia, and so we do have some challenges with that. A lot of the school systems are doing 100% online learning, and now we have younger kids that, you know, have to have somebody at home with them, so we're faced with those challenges as we're moving forward. Technology, we are still working through how can we use technology as we move forward. I talked about what we were using. But our challenges happen to be cell service inside the plant or internet service. Even though we're a very big state, I can still be doing an inspection in downtown Atlanta and still have some challenges with cell service. And sometimes because of security reasons, the industry does not want you tapping onto their Wi-Fi. So it is going to be a challenge as we move forward. It's not an impossibility, and I'm looking forward to trying to figure out these next hurdles that we're faced with. But we are facing the same thing I think everybody's facing here in Georgia.
Yeah, this is Glenn. I'll echo what many have said before me. We have really worked with our staff, and our number one goal was really their safety. And so we have made some shifts working with our center partners. I mean, you look at some of the body of work we're doing, whether it's a mission critical or a prioritized surveillance inspection. You know, we're not trying to do the full scope PC. Our goal is do the limited. It requires less time, less people, and less time in the firms. You know, you look at some of the work we did with CIPSAN as far as environmental sampling. That work's on hold. That's considered low priority because once again, we want to maintain the safety of our workers and just not have them in these firms as long as it would would normally require to do something like an environmental sampling assignment. So, I mean, we've been communicating with our staff. We're still under maximized telework for our investigators. So, for the most part, most people are working at home, and they'll come in the office when they have to. But we've had a great outpouring from our staff when we've had mission critical work to be done and or our prioritized domestic surveillance inspections. We've had no problem getting people willing to volunteer to work. Like I said, we spent a lot of time making sure we had the proper forms and instructions on how to protect our staff, and also the right questions to ask firms prior to going to these the inspections we've been doing. And we continue to adjust as, like I said, as the pandemic moves forward. We have to be cognizant of that and make the appropriate adjustments with our staff.
So this is Steve. I think the one thing I want to add and expand upon some of Betsy's comments. We've been out of an office setting, we're not doing inspections, but out of an office setting since about the second week of March. And one of the things that never came to my mind as we were doing this was the importance for some of our staff of having that daily communication with other people, and having not just be via email and text and those sort of things, but to actually be able to talk to them. So that's something that we've approached very differently. And throughout this, we've evolved it, but I just wasn't something I would have ever recognized in my mind as being as critical as it was. So I think that's one of the takeaways from this is when you can't be in an environment where you can routinely communicate with people in your normal fashion, it probably requires additional and different types of communication than what you might expect.
Great. Thanks, everybody. That was some great feedback. Maria, do we have any other questions in the queue?
I see no hands and no new questions in chat.
All right. Barbara, do we have any other ones that were pre-submitted?
Yeah, I've been kind of sorted through them, but let me ask this question. The Partnership for Food Protection is all about bringing people together to come up with best practices to solve problems. Any of the panelists think, is there something we need to work on as Partnership for Food Protection, put our focus on, because we are getting ready to write our next strategic plan?
This is Betsy with Consumer Brands. Unsolicited recommendation, perhaps. I think what you all do and how you bring people together is incredibly important. And I've participated in a few of these discussions in the last couple of years, and I've always been impressed with that. I would say when possible or when appropriate, bring in the industry to talk through. I think the partnership that we're working with ACTO on some of the issues Steve talked about is going to get a better long-term product that's usable by everyone. And so any ways of bringing in industry or other stakeholders to inform, to get a more realistic process that will be more durable would be something I would suggest.
Thank Betsy. And I want to just acknowledge, as a co-chair for the Governing Council for the Partnership of Food Protection, we have talked about that over the last year or so. So I think that input is really appreciated.
I think one other thing that would be worth taking away from this, and really taking it to a really formal level, is truly doing a true after-action review on COVID and looking for opportunities to do some serious process improvement. I think you're hearing some of the pain points, but doing that and taking it as a serious opportunity for improvement would be very, very helpful. And I don't want to, in our lifetime, we've never seen an event that was a public health event that's been responded to, and I'm just going to be honest, in a political fashion as it has been, and that really limited the ability of the public health agencies to do the good work they normally do. But I'll tell you, there were some questions that never in a million years would I have guessed I couldn't get an answer to, a straight answer to. And I think the question is still out there. What sorts of protective equipment, not necessarily PPE, but protective equipment, should we be using with inspectional staff? That was a giant. My answer was, I can't tell you that. We know, but I can't give it to you. That's not an acceptable answer in a public health system and an integrated food safety system. So we have to work through those sort of things and get better.
Appreciate that, Steve. I think in my personal view is, not speaking for the PFP, but just for Barbara, honesty is everything. And we got to be able to face up to that and then figure out how we work through the dynamics, political or otherwise. That's all I've got for questions, Pat, unless you have any more. Or Maria, you see a hand up?
I do not.
Yep, I don't have anything else on my end, so I think with that, we can certainly thank everybody for their time. Really appreciate you taking time out of your schedule to join us today. The slide decks, we'll make them available on the PFP website here in the near future. Unfortunately, we had some glitches with recording, so we'll only have the Q&A portion recorded, but we'll certainly make that available as well. If you have any questions, for any of the presenters or for us, you can send them to either to myself or to Barbara, and we'll certainly get you connected with the presenters to get an answer to your question or get some additional insights. But with that, if the presenters could stay on for a couple of minutes for us to close out, we'll thank everybody else. We'll let you get back to the great work that you do every day, and we appreciate your participation and your attendance. Thank you, everybody.